Please welcome Cecile Henrich-Burkhardt, Technical University of Munich.
Our mission is the entrepreneurial spirit of researchers and students to the benefit of society. TOM entrepreneurship helps to develop ideas into products. I am Cecile from Patent and Licenses, responsible for smartbax IP since 7 years. We nominated smartbax because smartbax addresses an urgent medical need, multi-drug resistances. The product candidates of smartbax act via a unique double-targeted mechanism which at the same time reduces a rapid spread of new resistances. The team around Professor Siebers, TUM Chair of Chemistry, has explored these innovative mechanisms for many years. It is therefore my pleasure to introduce Robert Macsics on stage as co-founder and CEO of smartbax. We think smartbax should be the science breakthrough of the year because preventing a resistance crisis tomorrow means taking action today.
Breaking the wall of antimicrobial resistance. Robert Macsics, smartbax.
Imagine you get a nasty infection, you go to the doctor, but there's no antibiotic anymore that could help you. Unfortunately, we're not too far away from this scenario because even today, 1.3 million people die every year of drug-resistant infections, and this number is expected to increase to 10 million by the year 2050. So it's clear we're hitting a wall of antimicrobial resistance straight ahead, and we haven't found a way to break through it yet. This is where smartbax comes into play, because we want to do things differently. While all existing antibiotics act in a similar manner that they try to inhibit some essential enzyme, we actually want to try the opposite. We want to stimulate certain enzymatic pathways and thereby drive the bacteria crazy. So how does this actually work? At smartbax, we have identified a unique dual-targeted mode of action that I now would like to present to you in more detail. One part involves protein secretion. So we target the protein SBSB, shown here, a signal peptidase that's responsible for cleaving off a signal tag of proteins that are exported out of the cell. When we chemically stimulate SBSB, we create an enhanced secretion of its substrates, and amongst these substrates are so-called autolysates. And these are very tightly regulated enzymes because they're responsible for remodeling the cell wall. And when they are dysregulated, we disturb the cell wall homeostasis, and they will start up chewing up the cell wall uncontrollably, and the cell will digest itself. We then found out that we also involve a second independent mode of action, which is involved in energy metabolism, because we also block the biosynthesis of the essential electron carrier minakinone. And when cells don't have minakinone in the bacteria, they cannot shuttle electrons across their respiratory chain, and therefore they cannot produce any ATP. So in brief, we both drive the bacterial secretion machinery crazy. Sorry, it's supposed to be a battery. We starve them on energy, and in the end, what we really see is that the bacteria die because they burst. This also has some favorable additional implications, because we see no detectable resistance development due to the dual mode of action. We see a broad spectrum of activity against a wide range of clinically resistant enterococci or staphylococci, all in the submicromolar activity range. We're able to kill persisters in biofilms, and these are really bacterial subpopulations that are especially difficult to treat because they're metabolically dormant, so they're not actively dividing cells, and therefore most antibiotics fail because they cannot be attacked by them. With our approach of actually activating a pathway, we can wake these cells up and therefore kill them where other antibiotics fail. And lastly, we can also see some preliminary in vivo activity with a pilot compound where we are comparable to a gold standard treatment like levofloxacin. Now, with that in hand, we now want to really go out and target those infections that are characterized by the highest medical need. So things like sepsis, endocarditis, or periprosthetic and catheter-related infections. Because here, we really speak about millions of case numbers, and not only in the Western market, but also worldwide, and mortality rates of 20 to 30%. So while we're fully aware that the antibiotics market is a commercially very challenging field, we really believe that with our novel antibiotics that are small molecules, they are therefore easy to produce, they are potentially orally bioavailable, we really hit a market gap where we could provide added value where new drugs are desperately needed. So smartbax is based on academic pre-work at the Technical University of Munich, stemming from 2016, but was founded as a company in 2021. And now we are currently seed funded by Boehringer Ingelheim Venture Fund and Heinrich Gründerfonds, two strong supporters of ours who really believe in our technology. And now the next big step would be a Series A funding that we aim for next year to fund our lead optimization up into the clinic. And we're, of course, also interested for investors that are interested in joining us on that round. Our milestone to hit the Series A is to have confirmed hit compounds for both our gram-positive and our gram-negative pipeline, which is something we have just recently ramped up from scratch, and where we want to further expand our enzyme activation approach to a completely new and untapped target. So stay tuned on that. This is the team that's pursuing the endeavor. smartbax can rely on both a scientific founders team with Professor Sieber and myself, and entrepreneurial expertise with Marco, our third founder, who brings in decades of experience in building startups, and together with strong scientists and also a strong advisory network of leading experts in antibiotic development, with also industry experience and decades of backgrounds, we are very confident that we can break the wall to antibacterial resistance.
I told you this guy is getting grumpy with the time, right? So we have many times. This is great. Let's go with the questions to Robert, please. Who would I take the first one? I have a look at the jury. No, the jury is first. I'm sorry. So please, Sabine.
Thank you. So I'm interested in what is about the competitive environment, competitors. How do you see the challenge there?
So that kind of mode of action is definitely unprecedented. So there's no one working on the same idea. And generally, if we look into current clinical development of antibiotics, there's 41 drugs in the development, and 38 of them address really already existing modes of action. So what most competitors do, they just do me-too drugs of already existing substances, and there it's clear that resistance development will be much quicker than with something novel.
Okay. Yes. Oh, that's a comment. And then we have another question by the jury. So a comment by Chaz, then another question by the jury. I see you, but
I think this is beautiful and well done. I mean, and one thing I'm really encouraged by is your partnership with BI, because that's what we keep hearing about AMR, that pharma doesn't want to develop it, etc. So well done. This is great.
Yeah, we're very grateful for BI to support us since the start of the company, actually.
Okay, great comment. Next question here by our jury, first row. Yes, thank you.
Are you only looking into the market with multi-resistance, or do you want to replace general antibiotics? And are you more effective than the antibiotics for the mass market at the moment, also with your approach?
It's, I think, difficult to define efficacy in that point, because you always have to compare to something that's already working in clinical studies. That's what makes it quite challenging in study design. So we think that we really want to focus on indications where we can actually add value. So not just replace drugs that would also work, but especially go in where other antibiotics fail. But of course, our aim is to have antibiotics that are generally widely applicable. And especially from an economic perspective, it makes sense to not just target the most severe cases, because then you will probably not create enough revenue.
Okay, I see no one in the jury right now. I have one question waiting for 3 rounds here. So let's give this gentleman the microphone. And I see you here also in the second row. Let us see.
Yeah, hi. I'm Isu. I'm still a student. So I work on mitochondrial toxicity, and one of the drugs that I use as a positive control looks quite similar to your compound. So do you see any potential side effects to the patients for your compound? Thank you.
Thank you.
So that scaffold is not final. I must say that it's a hit compound that we still optimize, but optimizing the window is definitely something that's our main focus at the moment, and where we really want to get even better. And yeah, definitely screening for cytotoxicity and off-targets is something that we have on the mind.
Very good. I see no one in the first row, so let's go to the second. Okay, you go.
Yeah, thank you for a nice talk. How does your compound differ mechanistically from the back protac from Boehringer Ingelheim, which activate the carcinolytic protease?
It's not a protac in a way that a protac would. It's first a completely different protein that it's targeting, and also it's not a recruiter for substrates in a way that it attracts substrates. It's something that really just stimulates the intrinsic activity and enhances the secretions.
Okay. Last super fast question. No, I think the jury was first.
Thanks.
No.
Sorry.
Okay.
Just about the biofilm
30
effect
seconds.
that you mentioned, how does the compound get into the biofilm and then act upon the dormant species there?
Thank you.
And we think that it has pretty good penetration properties in that regard. So it must be correlated with the physicochemical properties, I would say. And to be fair, we haven't yet managed to really investigate how it's exactly interacting with the biofilm, but we do see a very good phenotypic effect, and that's where we build upon.
Perfect. 4 seconds left. Wonderful. We managed 5 questions. That's very great. Thank you so much.